So I'm going to talk to you about modern approaches to breast augmentation. In the modern day, patients come in and they are not only thinking about their breast augmentation, but they may be thinking about what happens the day after their breast augmentation and what happens years later when they no longer want their breast augmentation and they may want that removed. So my thinking with breast augmentation is to offer a procedure that augments and improves the shape and the appearance of the breast, but at the same time does not destroy or damage the basic structure of the chest and the breast. So as we've moved through the 80s and 90s, the early 2000s, we've moved away from the massive breast implants going under the muscle. We preference a more subtle operation, perhaps under the gland or under the fascia, which doesn't affect the muscle and doesn't interfere with the muscle quite as much. The muscle, the breast sits in front of the muscle, so the implant should sit in front of the muscle. So if at all possible, I've moved to going to a subfascial breast augmentation with fat grafting, as well as reinforcing the inframammary fold with an internal bra. In situations where patients are very skinny and they cannot camouflage the implant with their own breast tissue because there's not adequate thickness of the tissues, this is when I'll elect to go submuscular. I do aim to be conservative in implant sizes so that if there's ever a time in your life where you don't want your implants anymore, removing the implants has not really destroyed the structure of the chest wall, and it hasn't stretched the skin out to the point where it won't retract back to its original shape and form. Another area that's modern in my breast augmentation practice is my return to recovery or return to normal function. I aim to allow you to return within the week to full activity and to work. I think that modern breast augmentation has moved away from the 3 weeks of no driving, 3 weeks of no work, and a recent study showed that there is absolutely no increase in complication rate if we allow our patients to return to work within the first week to 10 days and return to exercise within the first 10 days. In fact, the quality of outcome as well as the patient well-being is significantly improved if we offer this.